The purpose of the integrated curriculum is to better tie basic science concepts to clinical medicine so that students are better prepared to step into the clinical years and to prepare them for their career in medicine.
Because of our integrated curriculum, you have the opportunity not just to learn, physiology at one time and pathophysiology at the other time. That really is incorporated together so that when you go into the hospital and you see a patient with chest pain, you're not really puzzled because he didn't tell you that he has a physiology problem with your heart. It gets you thinking in sort of a bigger fashion from the very beginning.
It's not 2 years of classroom training followed by a sudden immersion into the clinical arena. It's integrating clinical training with the basic science training from day one.
The idea is that in medical school, it's easier for the students to learn the basic medical sciences if they can see the clinical relevancy of the material. And also they can practice using the basic science information to some extent.
The curriculum is unique in the sense that we've evolved from the traditional curriculum of 16-week courses into a block system. I think when you marry the block system with the doctoring course and with the utilization of the simulation center, you now have 3 opportunities for the students to learn both didactically, learn about professionalism, and learn the integration of preclinical with clinical. I think that stands at the foremost of what we do.
During the first year of medical school, students will do histories and physical examinations and become comfortable in a simulated environment with actors who are playing the role of patients. During the second year, we have them still in a simulated environment but working with real patients. The doctoring course is a 4-year course, but it's the fun part of the first 2 years of medical school. It's when students really feel like healthcare providers.
Our doctoring course does an absolutely fantastic job of giving you the opportunity to develop your clinical skills from the very beginning of med school. Even in the first week, you go across the street and have the opportunity to interview a patient, which is something that I think is really unique about Temple. That I knew how to use my stethoscope in the first month, and I could interview a patient and do a history and physical by the end of my first year. And that's something that by the time then you go into the clinics, you have so many other things to think about. It's really wonderful that you have those basic skills to get you going.
You do have different departments working together to try to coordinate the courses that we're taking. It's good because the patient isn't going to come in and say, oh, I have a histological complaint here. It's going to be, my leg hurts, doc. How can you help?
People were always willing to sit down and explain the pathophysiology of whatever they were helping us answer, or they would go through the anatomy of what they were going to operate on. I mean, there was always a lot of clinical correlations from every department that I interacted with.